All right, so we know that we want to mobilize the sacrum in the posterior to anterior direction based on a hard infill that we found with the 6-point spring test. Now we want to create space, okay? So we want to actually gap that innominate away from the sacrum so that the sacrum can move in the relative anterior direction. The best way to do that in this position is to actually hook on the PSIS, especially on the side of interest for you from the sacral spring test. So I found that the right ILA was the hardest infill. So I want to gap the right PSIS away from the sacrum. Now, if you go back to the soft tissue considerations video, a really important area to consider doing some soft tissue work is a bony contour around this PSIS. It's going to be super important to get that gapping motion. In fact, a lot of times it's just the soft tissues in this area that are keeping it from gapping. And so when you do that soft tissue work, it may free it up to where whenever you check to see as you internally rotate the hip, if you get to the end of the hip motion, which she has a lot of internal rotation, when you get to the end of that hip motion, then the next thing to move should be that innominate gapping posteriorly. So I would just kind of sink in to the depth of that PSIS, and then I just want to feel, does it feel like it gaps? And it actually kind of does feel like it gaps. Then if I sink onto that level, go to that barrier where it feels like it should move, and then I do a little spring test, I want to see, does it actually move? And I can feel kind of all along that PSIS, and there's an area down a little bit lower that feels like it doesn't want to move. So now in order to mobilize that, I use the hip external rotators to engage that hard infill. So go ahead and pull in with your leg. Good, and let it go. And so now I am actually pulling or trying to gap PSIS. Hold there, pull in, good. Away from the sacrum and let it go. And I'll continue to work on that until I felt like either it was moving really well or I wasn't making any more progress. So that then the next technique will be doing an actual posterior anterior mobilization on the sacrum.